this conversation for folks who cannot join us today, and just spend a couple of minutes as we are gathering here to share some marked by COVID updates with our community before we jump into our conversation with Dr. Thrasher in a few moments. But as folks are coming together, I just want to acknowledge that this is a really hard day. It's a really hard day in particular for people who have been doing their best, going above and beyond for themselves, their community, for people in our communities that we're trying to protect. And yet again, we're seeing the rug brought out from underneath us. And I'm angry. I'm coming into this space really upset about the CDC guidelines. And I want to just acknowledge that I know for many of you who are with us today that these are life and death situations for you and your loved ones and yourself, and that this isn't right. We should not be putting we should not putting ourselves, we should not be putting our communities at risk in the way that we're doing, and that it's political. It is, it is not okay. So just wanting to acknowledge that first and foremost. And I think that this conversation will be a opportunity for us to kind of work through some of what we're feeling, and I hope will inspire each of us to be able to have a little bit of grounding for the hours and days ahead of us. So without further ado, I would love for folks, to just share. I see folks sharing in the Q&A in the chat where you're coming in from, and before we jump into this conversation, I know that there are some folks who are newer to Marked by COVID. And I want to take just a moment to just give a little bit of background on who we are, if you're new to us and new to me. But Marked by COVID is an organization that was founded by and is led by people who have lost loved ones to the pandemic, and who also are suffering from other fallout from our actions and leadership. We were co-founded by myself and Christine, who's also with us here today. And we basically launched it a couple of hours after my dad died from COVID in June of 2020, with a public launch a few days later after his funeral. The main thing that we've been working on is building community amongst us, providing support to one another through advocacy and action. And we've been working to advance a call for a COVID Memorial Day. We've also been working for permanent memorials, as well as a COVID Truth and Reconciliation Committee, or a commission, to fully investigate the pandemic response, so that we can have a clear historical record of what happened and why, so that anything, so we can pass on learnings to future generations to ensure that when the next pandemic happens, or we're in a monkeypox crisis already, we have lessons that we can pass on. For folks who don't know me so well, prior to doing this work, I worked with a number of environmental justice organizations doing organizing and advocacy work. And, in the moments leading up to my dad's death, he lived in a very working class neighborhood that I grew up in, which is about 80% Latino, 40% immigrant. And at that point in time, he and that neighborhood were one of the highest places, not only in the entire country for COVID cases, but also the entire world. And I had recently just gone back to graduate school to do a policy degree in thinking about how do we approach systemic change from an equity lens to really get at the root causes of so many issues that I care about, whether it's health inequity, environmental inequity, so on and so forth. And similarly, in that moment of time, what we all witnessed, the brutal murder of George Floyd. And I remember the entire sort of universe, it felt like, of corporations making declarations to the struggle for Black lives and, saying that we're going to root out racial injustice and really tackle the system and police brutality. And while that gave me, while I was inspired by people going into the streets and kind of uprising for the rights of Black lives, I also at the same time just was looking at those commitments saying, I feel like these are going to be hollow. And if we really did care about Black and Brown folks, we would be doing so much more in this moment also to address COVID. And so for me, in sharing my story and then kind of going forward from there, it was really sort of a moment in which I realized that I could never ask anybody else to muster the courage to share theirs if I couldn't share my own. And from that moment, we have been doing our best to charge forward. So that's a little bit more about Marked by COVID, about us, and we're really grateful for the new folks here, as well as our community members who are with us today. We're going to get started with the conversation today with Dr. Thrasher. He is somebody that I've been following on Twitter for quite some time. When I saw that he was coming out with a book called The Viral Underclass, which we're going to talk a little bit about today, I immediately reached out to him and was like, come to our community meeting once it's out and talk about the book. And that's us. We are the Viral Underclass. And my excitement and of course he generously agreed, but my excitement was really driven by what I know of Dr. Thrasher's studies, to his commitment as an HIV/AIDS activist, and also in looking at the systemic issues that really create the conditions so that when a disaster hits, it not only hits all of us, but in particular hits a certain set of us first, hardest, and longest. And I am really grateful to be able to share this space with you, Dr. Thrasher, and to also introduce you to our community a little bit further. So without further ado, I'd love for Dr. Thrasher for you to share a little bit more about your background and also just some opening thoughts as you're entering into this space.
Well, thank you so much. I really, I just feel really honored to be here, Kristen, and I wanted to begin by acknowledging your loss of your father, which I have gotten to read about over the past couple of years, and thank you for the ways that you have been present to your loss and felt it and used it as a way to connect with others and allowed them to feel their own loss. And one of the things I hope with the book that I've understood after I've written it, and also sharing about my loss as you have, is that I hope it gives people a space to be with their own loss, because there's so many ways that we are encouraged in the society, including today with the latest news from the CDC, just to move on. And so I am very grateful to be in the space, and I imagine everyone here has lost people to COVID or has lost people to related issues in our society. And so thank you for just wanting a moment to honor those people that you've lost. I'm so honored to be here. And this project is the culmination of a lot of thinking and writing and research I've done for many years, beginning originally with actually the book itself and sort of where it jumps off with the story of this young man, Michael Johnson, who was a young man who was arrested for HIV and prosecuted and originally sentenced to 30 years in prison, began a lot of my research on this. But prior to that, I had started to do a little bit of writing about HIV and AIDS, and I've tried to, in my work, to find the things in life that connect us in sort of difficult ways and positive ways. And one of the things that I really have been thinking about a lot, particularly since my launch party the other night, where I felt very lucky to have an institution that would go beyond the CDC. The Strand Bookstore in New York City has a vaccination policy, and they have a mask requirement. And so I was able to be with about 140 people. Some I knew and loved for decades, some I was just meeting that night. But I was really grateful that they gave us that space to be together safely. And then we had a party afterwards in Washington Square Park outside where people could have some refreshment safely in a ventilated area. And so I feel a real sense of mourning and sadness as I see the CDC and so many parts of our government not giving us the infrastructure and the space that we can be together safely. I feel really grateful to have had that. And on that evening, I was thinking a lot because there were many people there. Some I was meeting for the first time, some I've known for years who were part of the group ACT UP. And they had been in ACT UP since its early years. They had been members of it in the 1980s and 1990s when they were doing lots of actions. And I was thinking a lot about how, these viruses that have killed many people, an entire culture has come up around them, and they've also given us all these opportunities to connect to other people. And I very much stand both on the shoulders of racial justice activists who've done work for decades, and also for queer activists that have come together in these moments and have used these viruses and these experiences being near death and have lost people to death, but to really use that as a moment to value what it means to be alive and to try to find ways to connect to each other in being alive. So in that way, the sort of culture that's come up around AIDS has had so much of an influence on gay culture and on my life as a gay man that I'm both aware and in awe and often mourning viruses, but I also have a sense of gratitude that they forced me to understand how liminal life is, and that they've allowed me to connect with so many other people trying to figure out how to have a relationship with them on this planet. And the COVID pandemic, I also think, has been an opportunity. So I sort of conceived of the book in one way when the pandemic hit, and then I really reframed it to sort of use this analytic of a viral underclass to try to understand what was happening and think about what was happening in this time, and not to in any way, denigrate all the pain many of us have felt, including me, to the people we've lost at COVID. But at the same time, it's given us this really special opportunity that American society has not had in 100 years to understand how fragile life is and understand how connected we are to one another, and that we really have to work together to make life livable and enjoyable, and to not fall into the sort of most base aspects of capitalism. And so I'm trying to keep in the sense of awareness, in a way, a sense of gratitude that this is it's very difficult, but it's a tremendous opportunity to be in connection with other people. And so in evenings like this, where I'm very sad and very angry that the CDC has abandoned us again, I also just have a real sense of gratitude to all the people here tonight and to you that, we're going to work together no matter how dark it feels around us. We have each other, and we're going to try to keep helping one another. And so for me, the book itself, I hope, is an articulation of a lot of these kinds of experiences I've had with people, both as a reporter and as a researcher, but also just as a human being, and trying to navigate the difficulties of life and trying to learn from the lessons that these viruses present to us in community with other people. And so I just feel really grateful to be here with you and with everyone tonight.
Oh, thanks. No, when I was reading through the book, I in the beginning, you take some time to describe your experience being in New York in March of 2020. And I just felt like I was there with you. And one of our board members, Sarah Sank, who's a scholar of memory studies, she's been kind of reading through the whole literature of the pandemic that's come out so far, and most of it doesn't focus on sort of the loss of life, the fear, the sort of big moment. And I really appreciated this kind of starting with that centering, because in absence of something like a memorial, which for folks who don't know, we're working on bringing a memorial and bringing a really big memorial to life. But in absence of that, I think New York in March of 2020 was the sort of one cultural moment, if you will, that people who have lost loved ones really can connect with, that sort of fear and isolation and absolute desperation. And so it actually made me think, like, I want to talk to more people who were in New York specifically in March of 2020, because I feel like in this sense of this community, they are part of our community, whether or not those individuals identify as having lost a close, friend or relative to COVID. Well, on this topic of community and community building, community has been, I think, really the only thing that has saved me over the course of my grief journey. And I felt that a lot through reading this as well. And I'm just wondering if you could speak a little bit more towards the important role that community plays in doing the work of staying present and finding joy while we are all in this struggle for life.
Yeah, thank you. In that time in March 2020, it was really scary, and it's interesting having other people read about my own experiences. I've been a journalist for a long time, but typically what I write is out pretty quickly and we move on. And so, I initially wrote this in those months, in the beginning of the pandemic, and wondering, is this going to be useful or interesting to people? Isn't everyone going through this? And this is another way I think that neoliberal cultural capital makes us think, just move on, think what you're going through isn't important. But it was a really, really scary time. And there are a handful of things that have happened throughout the pandemic that I think make the experience very different for different people. Obviously, one is if you've lost somebody close to you, you have a very different experience that connects you to other people have than people who have not. Another is, I found, did you either live in New York or did you live near a hospital? Because even some people I've talked to, and this is, for your colleague or other people, I think this would be a really interesting thing for memory studies about this event. I've also found people who lived in the middle of Idaho, but they happened to live in the town with the hospital. And when they had the sensory experience of hearing the ambulances, it created a very different experience in this pandemic. You had a real sense of the immediacy. And for many of us in New York, I think it ties into memories of 9/11 and other things, but there were times where you just simply could not escape the sirens. So even people who were relatively well protected at home, you couldn't ignore it. You just had to be present to it. And your presence to it could be, you could try to avoid it, but you really just couldn't avoid it entirely. And community was really important to me. I had recently moved to Chicago. I had just happened to be in New York to talk about my work on another virus. And I was really blessed that I was staying with friends of mine who had a decent sized brownstone with room for me. And so I stayed for those 3 months. I think I would have been in a much worse emotional place. And I'll be honest, I suffered a lot. I had depression at times. I think that people who lived with others and couldn't get any space in their home did not do very well. People who lived alone suffered a lot. The people I thought did the most had community, roommates, family, but had enough space to occasionally to step away from one another. But during those first 3 months, I did live with these close friends of mine, and that was a lifesaver. And we were the beginning of a mutual aid network, but they were also in a block where they were quite well connected to all their neighbors. And so this informal mutual aid network quickly came to be. And that was a real lifesaver.
literally a lifesaver for a lot of people as we navigated how to get through this. And that first summer of 2020 was almost magical in how present and intentional everyone was about everything we did. I went to, as I write about in the book, I went to my first Zoom funeral. That felt really alienating in some ways, but we eventually learned how to socialize with it. But then we sort of learned we could be together outside. I think we were still staying quite far apart in those first few months, but there was a real intentionality and a real reflection on what was important in life and not taking things for granted, understanding that this was not business as usual, both in sort of the fear that we had about our own safety and as we saw people who lost each other. And the first person, as I write about in the book, that was in my outer social circle was Lorena Borjas, who I had met just once, I think, when I was working on a story, but she was very close to other people that I knew. And at her Zoom funeral, there were about 400 people on the call. And that was it was alienating and frustrating in a way. It was also great that people could acknowledge her right in that moment. But it did really make me think about the role of community, because my parents, who are long deceased, my dad died in 2003 and my mother in 2007, they raised me in a community where you would go to funerals of anyone marginally connected to you, anyone at the church, even you know them closely. If a colleague's relative died, you would go because you're only, if you knew the deceased, of course, you're there to have your moment of thinking about them, but you're really there for the living still. And it made me think about how, unfortunately, even though there were blessings in it, I've gone to many funerals for trans women in New York. A couple of them I knew personally, but often they just knew people I knew, and I was there to be in community with others, and you sort of see how people are doing and see how you need to follow up with them. And so there was some ability to do that in Zoom. I saw, I went through the screens and I saw who I knew and emailed them and said, hey, do you want to talk on the phone? But it was really difficult not to just be able to hug each other and physically be in community. And Larry Kramer died around the same time too. And I remember a few people went out. That's when no one was going outside at all. A few people went, to acknowledge his death. But community has been at the heart of trying to survive this. And as I keep thinking about in the book over and over again, viruses blow away this idea that we're separate beings. They're connecting us all the time. With HIV, a lot of that connection was stigmatized through sex or injection drug use. The same thing's happening with monkeypox now, and so those have their own dynamics, even though I think a lot of the social things connect all of these different pandemics. But with COVID, it was so incredibly casually transmitted that there was just no denying that we're not connected to one another. And so it forces us to understand we have to work in community, and it forces us to see that the American concept of individualism is bullshit, that interdependence and many things that people in the disabled community have long practiced themselves and tried to get the rest of the world to practice for their well-being, but also for everyone's well-being. It really forced us to confront that. And that's one of the things I find saddest right now in seeing the CDC or businesses or even organizations or even family members that I'm close to not wanting to sort of reject that, say, everyone negotiate your own risk, you have to do what's comfortable for you. It just doesn't work that way. And so I feel like in the summer of 2020, people were quite open to what we had to do to survive. And I hate seeing that disappear. And just one last thing I want to say, I want to have time for questions from the community. I've thought a lot about how, many people's work schedules have changed. Of course, many did not. And people who are essential, quote unquote, essential workers, doing face-to-face work, many have gotten sick many times or have lost their lives. But many people also got to work from home, and the way they spent their time changed. And it's been interesting watching businesses and government try to force people back into the office when a lot of people found much more meaning in their lives being able to do other things. For example, I had two different friends who worked in office jobs who kind of became the coordinators of their mutual aid networks in their neighborhood. And they loved it. I think many people would rather not be marketing, I don't know why this is the example I always go to on Twitter, but 85 different flavors of Oreos. A lot of people don't want to go to bullshit meetings. And if they can figure out what their business wants them to do in 4 hours rather than 8, they would be quite happy. Also, shopping for food for their 85-year-old neighbor. Like, they get a lot of meaning and joy out of that. And a lot of folks had a lot of connection. And so I hate the way that so much of government business is trying to atomize us again in ways that deny those kinds of experiences to us, because many people they're not just selfish. Like they like doing things for each other, and they like feeling like their time is spent in valuable ways. And that first summer of the pandemic, I think, allowed for many opportunities like that, and allowed more people who knew about mutual aid and things like that, allowed many more people to understand what that was and to get excited about it and to participate in it.
Yeah, I'm so glad that you brought that up, because that was my experience living in San Francisco as well. And up until recently, as the nation has moved more and more, and government has pushed this narrative that the pandemic is over, and that it's time to return to normal or business as usual. Though the sort of the environment that I once lived in is crumbling, and I often talk to folks within our community who say this of like, whenever we were supported to stay home, it wasn't like people were just lying around doing nothing. People were helping one another. People were filling in that last mile gap, if you will, and supporting community health, mutual aid. And, even in my own activism, I was laid off from my paying job as a result of the pandemic after my dad passed. And I've been doing this work full time plus unsupported. And it's just this sort of like, people can rise to do great things whenever the situation and the circumstances are correct. But it feels like the entire gravitational force is pushing us into this very narrow funnel of pre-pandemic that literally no longer exists, A, and B, there's no going back to normal for so many of us, either if you've lost a loved one or you're a disabled person who can't go outside without risking death. And also, finally, normal is what got us here in the first place. I don't want to go back to that normal. So I know you touched on this a little bit, and this is, sort of the big theme of the book. I'd just love for you for somebody who's kind of entering this maybe for the first time and thinking about these larger systems at play, I'd love for you to just talk a little bit about that, and also to give you just a little bit of background. I've met so many people who've lost a loved one to COVID, who have grown through their grief journey, and seeing, and maybe initially being angry at the person who gave their loved one COVID, the healthcare worker who wasn't masking, or was wearing not wearing an N95, or was reusing a mask. And over the course of this journey, have seen people turn that frustration from the individual and see that person was probably underpaid, was probably overworked, was not supported to show up safely to caretake for their loved one, and instead are turning that frustration to the system that is extracting wealth, in particular from people who are disabled or chronically ill, or folks of color. I love these hearts. I feel like I'm feeling the love. And that to me is like, that is the well of hope for me. So for folks, I just would love to hear from you, and I know our community would too, just about this sort of larger system that we're all in.
Sure. Yeah. So I think that in an interesting, you bring up a really good framework for talking about it, which is let's talk about nursing homes and the relationship between people in the nursing homes and labor in the nursing homes. And for me, this was a personal site of inquiry and emotional experience, because the person I lost who I was closest to in the pandemic died in a nursing home. My former Village Voice editor, Ward Harkavy, and as you can read in the book, it's
and it's an absurd situation how he even ended up in the nursing home. That he ended up in the nursing home speaks to all these things about the Cuomo administration, really how Democrats bungled things, as disastrously as Trump was in many ways that first year. But it was in my conversations with Alice Wong where I really started to have a way to think about nursing homes with something in a way I hadn't thought of before, which was the same framework that I think about prisons. And I've written about prisons for a long time. HIV prisons are an engine for HIV, so are local jails. Prisons are engines for all kinds of pathogens for obvious reasons, but also kind of for conditions they create. Once you're in the prison, you can't get work, you can't get housing, you're more likely to end up not having healthcare and becoming sick again. But I hadn't really thought until I had these conversations with Alice about how prison and the need to abolish prison is something that applies to nursing homes as well. And for people who aren't familiar with the concept of prison abolition, or maybe you've heard about defunding the police, the idea of prison abolition is that you create a world in which prisons are not necessary. It's not just about sort of opening up the gates and letting everybody out. It's about understanding that if you created a world where people had the things they need, you wouldn't need the prison in the first place. And so you work to create that sort of world, knowing that the continuation of the prisons is just going to continue a cycle of problems. And Alex helped me understand how a lot of this happens with nursing homes as well, that we don't value people who are quote unquote not productive or not productive economically, that we move them out of sight and out of mind. And so when the pandemic comes, these are people that have already been disappeared from society in so many ways. And this applies not just to elderly people, like my friend who died, but also to congregate care settings for people who are disabled. So one in every 10 people in nursing home died of COVID in that first year, I think. And then it was still 1 in 12 of disabled people who are younger, but in congregate care settings. And so that brings into question all these things that an abolition framework would help deal with. That the nursing home itself becomes this site of just extracting capital. And so old people are put there, their entire life savings is sucked into this. Their families are spending all this money on this as well. And at the same time, the workers are getting paid shit too. And they're not getting the PPE they need. And one of the reasons why I started seeing similar maps with COVID and HIV and other pathogens was that, HIV historically has affected people a little younger more. Many people in nursing home are quite old, but the nursing homes where people were dying the most were poor areas with poorly paid staff and really exploited patients living inside of them. And so if you see that both the patient and the worker are being exploited, they don't have to be angry at each other. They're not the reason the other one is suffering. The reason is that they're both being extracted from capital while a third party, which is increasingly becoming just a handful of corporations that keep buying up all these nursing homes, are sort of stealing all the resources. And it's not cheap, just like prisons as well, and homelessness as well. You could say I saw this on Twitter the other day, someone saying, you could say to voters, would you spend $130,000 a year just on someone who does have a home to give them a home? And many people would not. But they would often vote for putting them in prison, which would cost that. And a nursing home would cost that as well. And at the same time, the orderlies in the nursing home taking very intimate care of their patients are also not getting paid much. And so if we say, well, there's a lot of resources here, what if we use them differently? What if those resources were put at keeping people at home, supporting them by staying in their families, giving the families an economic reality where, because most people don't want to get rid of their mother or their grandmother, but they're working 40, 50, 60 hours a week themselves and they can't do it. What if we allocated these resources differently? And so I think an abolition framework to abolish the kind of world where people who are disabled or elderly are just shoved out of society in the first place. And there's some people who need serious medical care, and those people should get it from people who are well paid and well trained and are supported themselves with PPE, with reasonable work schedules, with the conditions that they can work well and take care of people together. So I feel like a lot of people were making those connections in the pandemic, and that's one of the reasons why the powers that be want to put us back to a mindset before this reality that no longer exists. Because people are putting together, they're understanding this. They're understanding that George Floyd,
is killed by the police department and the police is taking 40% of that city's budget, and what if the money was spent differently? Those connections are starting to come together. But I feel like one of the biggest things I learned in writing this book and learning from disabled activists was to have an abolition mindset about congregate care settings where people are forced by circumstances of society to be in these really dangerous places in the role of a virus. And I feel like a similar kind of disaster is in the making right now in a community very close to me, gay men, where if we become infected by monkeypox, you're being quarantined at home forcefully by 2 to 4 weeks, which is the responsible thing to do from an infection standpoint, but they're not being supported economically. So the state's basically saying you are locked in your house and you may starve. And many people, their friends will bring the money, but nobody can afford to not work for a month and not end up on the edge of eviction if not being evicted. And so the state's sort of saying, like, you must stay in this congregate place unsupported and take care of it yourself. And all of these kinds of sites of forced containment, forced being need to be abolished so that we can have a society where we're more easily to take care of each other and where the resources aren't getting sucked off from the people doing the caretaking work and the people who need the care.
I hope you saw all of those claps and hearts that were coming out in response to that sort of global picture of the system that we're in. And I'm really grateful that you brought up this abolition framework, because at this point in time, we have so much to learn from the individuals that have been leading the fight for disability justice, mostly disabled activists, for decades now. And it's something that inspires me, and I'm really excited that Marked by COVID's been working more closely with the Senior and Disability Action over the course of the last several weeks to pressure the San Francisco Public Health Department to set aside the CDC recommendations and prioritize public health and bring back some really sensible measures, as well as an equity focused way of on-ramps as well as off-ramps. I want to make sure that folks in the audience have a chance to answer questions. And I initially set this up so that you and I could have a little bit of sort of webinar talk, but I'm going to actually bring some of our regulars from the Marked by COVID community into as a panelist, because I really want you to be able to meet some of these incredible folks. And the thing that is really central to our mission is ensuring that the people who have been most harmed are centered in the response and the recovery, and whose stories they're able to tell. We are able to tell our own stories through our own voice. We don't need the cisgendered, non-impacted, well-intentioned white dude to, film us or, project our stories out, which that's a conversation for another day because that's already happening. But I want you to meet some of these incredible individuals and have them have the opportunity to ask any questions. So if you are being promoted to a panelist right now, you should go ahead and feel free to come on in. And I, in the meantime, am going to, hopefully this works. This is my first time trying it this way. Oh, great. Excellent. It's saying folks are joining. And would love to open up any questions to Marked by COVID community members for Dr. Thrasher. And as folks are coming in, feel free to take yourself off of mute if you have a question. So great to see you, DJ, Lucy, Jennifer, Jared, Deshira. Great to have you here. Sarah, great to see you. Hey, Lucy. So these are some of the core folks that have been part of our community meetings. We're really excited to have you here. Does anyone from this group have a question you'd like to ask Dr. Thrasher?
I don't have a question. I just have an immense amount of gratitude for the work that you do. As someone who's immune compromised and lost my mom, the news today just reconfirmed what I already know, that I'm deemed disposable. And your validation, supported by your knowledge and statistics, it's just so, thank you. I needed this today. Thank you.
Thank you. Thank you so much. That's very touching, Jennifer. And yeah, just thank you for sharing. And I really appreciate the generosity. So many members of the disabled community have shared with me, and the people who've let me write about their lives. And I wanted to circle back to something Kristen had said earlier, kind of thinking about who tells stories. I try to tell lots of different kinds of stories in my book, and I'm not a part of every community, and I'm sure I make some mistakes with some of them, but I also try to, and this is something I really admire from this community and from Kristen personally, that I think when we share our own, our own particular story and what our own vulnerabilities are, then that helps us be able to be in conversation with and share about others. And so I just really appreciate you sharing, Jennifer, and I feel really, it's been really challenging and sad with where I teach and some institutions I'm a part of, to just see how they're not willing to do very minimal things to try to keep people who are immunocompromised able to participate in life and be a part of what we do.
Thanks so much, Jennifer. Marie, would love to hear from you.
Yes, good evening, and thank you for joining us tonight. I enjoyed your meeting or your talk at the beginning very much, and I'm looking forward to reading your book too. This is a question, and I don't know if you can comment on it, but on the news tonight, they commented that the CDC, everything was going to go back as far as masks and no more distancing and vaccines, et cetera. And then they prefaced that, though, by saying that, COVID is here to stay. What are your comments on something like that? When we have people dying every day from COVID, and, here in North Carolina, I live in the western part of the state, and right now there are a lot of new cases up here where people are getting COVID. So what are your thoughts or comment on that as far as, from CDC and the national, the government?
Thank you for that question, Marie. I find it very concerning that they're just saying it'll be here to stay. And I sort of understand in a technical way, this virus is probably not disappearing from the earth entirely. But that doesn't mean you don't try to mitigate it as much as you can. And so I'm really disturbed that they just say it's here to stay. And there are all kinds of, there are many viruses I've studied, my colleagues have studied, that are in the world. And even ones that are quote unquote endemic, that doesn't mean that you don't try to do everything you can to not have them show up. Same thing with monkeypox. Monkeypox has been in several countries in Western Central Africa, very poor countries, where it has a home in rodents and it will come into human beings periodically. And yet, even though it's been around for decades, these sometimes very poor countries were very vigilant about trying to lower it. And so I feel really worried that they're just saying it's here. And they keep framing it as if it's going to be something like seasonal flu, which I'm sure everyone here knows. Flu's bad enough, but this is much, much worse than influenza to deal with. And I feel very sad tonight, and I'm sure I'll have more thoughts tomorrow, but even at times with even more death, when there were 3,000, 3,500, almost 4,000 people dying a day, there were people like the New York Times' David Leonard, who were like trying to say, it's here with us, we just have to accept it. And so I think that we have to fight it, both as a community, but also, and there are some, they're not in the majority sadly, but public health people who understand any part of any public health campaign is about has to include trying to lower transmission. Even when you have influenza has been around for 100 years. It'll probably be around for 100 more. That doesn't mean that there are like lots of things that we know how to do to make it be around less. And so I'm just appalled that many of the things we know that do work keep being stripped away. And I don't even know if I should put this into the universe like this, but I sometimes wonder, like, are they just going to say, surgeons shouldn't wear masks anymore? they just keep denying that masks actually work in ways that we've long known that they work. And so, yeah, it's a great question, Marie. And I just find it very concerning.
Thank you.
We're gonna go to Lucy next, and after that, I have a question from somebody in the audience. Lucy.
Hi, Lucy.
Hi, Stephen. Thank you so much. I'm looking forward to reading this book. Something I didn't really think of, but I just want to, not so much a question, but I just had this experience when the CDC, when I read that today, I was pretty disheartened. I recently was very ill. I was ill in July, which it started early July, and I was pretty sick for most of the month. It was a respiratory problem. I took 3 COVID tests in like 6 days, and they were all negative. So, but I still isolated, and I stayed away, and door dashed and Instacarted, and did all that, and finally got better. But coincidentally, yesterday or Tuesday, I had a doctor's appointment. And I talked to her about that, and she said, well, you were sick that long with those symptoms, which were the same symptoms, by the way, that I had. I hadn't been sick since March 2020, when I had the first, by the way, I lost my whole family. I lost my husband, my mother-in-law, my sister-in-law, and a nephew within 2 months' time. I was the only survivor. And so when I went to the doctor, I explained it to her, she told me, I'm sure you had COVID, because she said that a lot of her patients, or one in particular, husband tested positive with symptoms. She had symptoms and tested negative. And she thinks that these home tests are not picking up the antigens of these new variants. And so I was just devastated today about no more distancing, no more, it's not gone away, and I'm devastated that this is happening, and happening to many people. I've been so careful, right, for 2+ years, and it's disheartening, I have to say. And one other thing is, I was thinking, the elderly have palliative care, where they have doctors and nurses that come to the home, and they get to stay in their home. Like my mother had dementia, and they put her in palliative care, which was part of the hospice care. And, it worked out great for her. And do they have this for the disabled? Maybe this needs to be expanded because of the way things are going with this pandemic.
Well, Lucy, on your second point, it's very hit or miss in the country. There are a handful of places in the U.S. where people are supported that way, and it would cost a lot less money. A lot of the lobbying is to get people into these congregate centers so nursing homes can just exploit them, but it's a possibility in other countries do it. But I, more importantly, just wanted to say I'm so sorry for the loss of your family, and there's nothing I can do other than say that I see and acknowledge that loss. And there are many people who have experienced that loss, and I'm sure I imagine it feels like a gut punch today to see ways to mitigate that happening. And I just want to thank you for sharing that and encourage you to keep sharing it with other people, because I think millions of people are suffering from this, and we're being encouraged not to talk about it and acknowledge it. And in my role as a journalist, I'm trying to slow things down from people just moving on. But I just want to say I'm so sorry for your loss.
Thank you. We have a question from the audience, and then we'll go to Sandra. The question is, should we be prioritizing trying to pressure national government to take more of a prevention role or more local organizing? Question mark.
I don't know. Yeah, I wish I knew more. I am very much a believer. The organizer Miriam Kaba says this often. I am a believer in the team of multiple ways to try things, and so all different variety of options. And so some people may work on stuff nationally, some people may work on stuff locally. What I'm found, and this maybe is not the easiest answer to hear, but as I've watched the monkeypox epidemic, should probably soon be called a pandemic, unfold, one of the things I felt very frustrated by is that it didn't take long for local places to kick into action. I was still frustrated that all this infrastructure from COVID had been dismantled that could have been used in this situation. But in the cities where the monkeypox spread is happening the most, they actually have decent public health infrastructure, and they were ready to go, and they had lots of community groups. And I feel very strongly right now, if magic wand was waved and 10 million, monkeypox vaccines showed up, gay organizations and gay men would, like, in a month, organize sort of getting them out to everyone. So in a way, like, that's a local success. We just don't have the fucking vaccines to get them out to people, which is the main thing. And so we get these, everybody do your own risk, and here's what you should not do. The underpinning of that as well is they're just like, well, just don't have sex ever again or for many months, or hug or kiss or do these things that are just part of being human. But I feel strongly like at some point we need state resources for these kinds of things, and we need corporations not to steal all of our resources. And if we didn't live in a world where vaccines were and medications were all created for profit for a handful of people, but once they were created, they were quickly distributed everywhere, and we wouldn't have this problem right now. So I do think working local is important. And I also think it's really great for your mental and emotional health to just do something with other people who care. Sometimes all we have is each other to get through the times of darkness. But for a lot of these things, at some level as well, the redistribution of resources being stolen by a few and the states facilitating that theft has to be addressed. And, like, as a friend of mine was talking about earlier this week, we had glimpses of that. Like, every 10, hundreds of millions of people showed up and got free medical care from the government. That is not something we are used to. That is a possibility. And it wouldn't have happened if the federal government didn't facilitate it in some way. So we do need that pressure at a national level too.
Thank you. Sandra?
Here in New York City, I think you said that the Barnes and Noble you were at was in New York?
Yes.
So I'm curious as to what kind of reactions you have gotten. I don't know if you've presented the book or done any presentations. What kind of reactions have you gotten, or perhaps even been surprised by?
So I just signed the books at the Barnes and Noble in New York, and I'm going into next month. I'm going to the Barnes and Noble where I worked as a teenager in Southern California in the 1990s, which I'm excited about. But I did the actual launch event we did at the Strand, an independent bookstore in New York, and I've been really touched at most of the reactions that people have had. It's a lot of me that's out in the world, and so that feels I feel a little nervous about that. I've really appreciated people who've told me that it's given them space to think about the experiences they've had. I've been really touched by people who've said it like helps them see connections between different things. And I've done many kinds of jobs of all kinds, but I've also done lots of different kinds of writing. And so in this piece, I was trying to, in the book, I'm trying to show that you can have different parts of your life and not have to deny others. And a couple of people have told me, I was very shocked when people started telling me the book was about love, which seems obvious to me now after they said it, but I didn't see it until other people read it and told me that. So that I really appreciate it. And a couple different people have told me a variation of appreciating that they could see the science and the art and the personal together in a way that helps them know you don't have to segment the different parts of yourself and sort of deny the different parts of yourself. So I've really appreciated that. But I'm trying to, as much as my ego will allow me, to just kind of, now that I've worked on this for so long, to sort of let readers have their experience with it, and hear what they're taking out of it. But so far it's been extremely meaningful, and I feel really, as a writer, I very much appreciate that people have told me like they've stayed up late reading it because they didn't want to stop. And I didn't know if that's how it would be. I've got lots of science in there and all kinds of and very sad things in there. So I've also just appreciated that it's been a reading experience that has been compelling for people and seems to mean something to them.
One final comment, what prompted that on my part, my father died in the early wave, April 13th, 2020, was that reading The Premonition by Michael Lewis, there was something about reading that consoled me. It was like, this didn't have to be like that. So I just want to thank you I will read the book, for taking the time to write the book, and just hoping that people, and I know people will respond in positive ways.
Thank you so much, and I'm so sorry for your loss, Sandra.
Thank you for sharing, Sandra. Dr. Thrasher has agreed to stay a few extra minutes with us, so we're gonna use it. There was a question also in the audience about long COVID, and I was wondering if you could speak more about long COVID and how the long-term health issues affecting millions of people are being ignored by so many.
Thank you. So I won't speak much to the medical realities of it because it's not my area of expertise, except to say that I do believe it exists and should be taken very seriously. What I've been more concerned about, that's a bit more in my wheelhouse, is akin to what we saw with the CDC, and that there's an offloading of government responsibility. And one of the best, I forget which one of my professors said it, but definitions I ever heard of neoliberalism, which is a word you may hear often. It gets applied to lots of different things. But the best definition of it I've heard is it's taking risk that should be experienced collectively and focusing it on individuals. And so I think with long COVID, it very much dovetails in these gendered ways around other long-term conditions like chronic fatigue syndrome, where it's imagined to be, quote unquote, women's hysteria, or people are making it up, which also dovetails into all these ableist tropes that if people were just strong enough, they would get over it. And this is a very bipartisan thing. I've been quite upset that Donald Trump, who is obviously like a cartoon of malfeasance around COVID, and when he had it, went on his little joyride in the limousine, was like trying to get back to the White House right away. And Biden was like had a very similar affect of trying to show, I'm 79, but I can just power through it. And, of course, he got knocked back on his ass through the rebound. And at no point did I sense that he would say something like, yes, if you're 79 years old, have COVID, you should rest. If you're any age, you should rest. And you will be, and you'll get your pay from unemployment insurance, and you should rest because it's going to keep you from getting long COVID. I did see a report from Brookings the other day, which is a think tank in Washington, and not like mildly centrist, but I would say even tilting right. But sometimes I've known people who've worked there. They support scholars who do some interesting work. They're very quantitative. But even they were like, they had a study before where they'd said we predict 1 million people with long COVID. Now they're predicting almost 3 million people with long COVID. And so there are problems with leaving those people to fend for themselves. So that's kind of my biggest concern. I have colleagues who work very much on the medical side of it. But I think there needs to be two payment things that need to be quite prioritized right now are paying for people to recover from COVID, paying people to recover from monkeypox at home, and then also finding ways to deal with long COVID for the long haul and making sure there's no possibility that folks are just called out, you were sick, you weren't strong enough, you're on your own for the rest of your life or however many months or years you dealt with this.
Thank you for sharing that. And for folks who want to read a little bit more about the bad example that President Biden made with his own COVID case, I dropped a link to an opinion piece that we published not too long ago on that topic. There's a couple of other questions in the Q&A that are, I think, a little bit similar but different, I think very important. So I'm going to ask them here. Can you speak to the role of anger in your work, both in HIV and now COVID, how to strike the balance between using anger for fuel versus letting it be destructive? And then Raya from Senior and Disability Action asked, do you have lessons from your studies of AIDS activism, particularly ACT UP, for those of us organizing against government abandonment of the population to COVID? Yeah.
Thank you. Thank you for both of those questions. I was very afraid because like my journalism work is not reviewed. And so I see reviews of the books. And one said that I was unafraid to let my anger shine. And I appreciated that very much. Although I would say like, I'm not unafraid to do it. I do it anyway. But and there was a very nice piece that the writer wrote. And I appreciate that because I would say, particularly as a Black man, I am not supposed to express anger in lots of places that I work, certainly not in academia or with newsroom journalism. And you know, and I'm speaking to my own experience. I think that many of you probably have these in other ways as women, as non-binary people, as disabled people. Anytime you're supposed to be grateful, you know, quote unquote, to an institution, I think this comes up a lot with people who are disabled or sick. You are not supposed to use anger. And I love Audre Lorde's phrase about anger is useful. It's full of information and energy. And so, and my favorite as someone who grew up in the church, whenever I'll tangle with people about the bastardized way that Christianity so often gets used as a cudgel, I say my favorite Jesus story is, you know, him going into the temple and chasing all the people who are exploiting people economically. That's the Jesus that I think of at Occupy Wall Street. But I think anger is really healthy. It's a place that denying anger has a bad effect on you. And anger is something that a lot of us should feel. I think we should be more angry. You know, we should be furious that the CDC is rescinding these things. We should be furious that people who have this very stigmatizing disease, monkeypox, are told, okay, you're on your own to just stay at home. And by the way, we don't have anything to protect the other, you know, the 9 million of you who are at risk who have not gotten it yet. So I find anger very informative. And I find as a journalist that there's this thing that mainstream journalists do often, is that they will completely facilitate the bombing of other countries and sending the budget all to the police and to the military, but they will do this tone policing where they say, oh, anyone who's angry, you're cancel culture or you're rocking the boat, as enormous violence is done to us. And so like what the CDC has done, like it's a very violent thing. It's making it so that, you know, Jennifer doesn't feel safe participating in things that you would want to, or it makes it so that if you do go, you could be at, you know, great risk. And it keeps the status quo where 500 people, I think, I haven't looked at the Times death toll for a couple of days, but the last time I looked, it was almost 500 a day. And that's a violent thing that's being facilitated. And we should be angry to counter that. And anger can really help us get there. And often I will see mainstream journalists tries to suppress those urges. So I think that's a good thing. And I'm sorry, I'm forgetting the second question that was part of that.
Lessons from ACT UP.
Lessons from ACT UP. ACT UP were very angry. And
that's why I put the two together.
And they got results, you know. And I've seen, you know, the action I saw, now that's too much to go to. ACT UP was often very angry. And for people, who are not familiar with the group, it's AIDS Coalition to Unleash Power. They still exist. I went to meetings up until the pandemic. But they were a group that really expressed through direct action that they were united in anger in telling the government things had to work differently. And we all benefit from that in enormous ways. The reason why the vaccine trials happened in a year rather than 10 years is because of all this activism that ACT UP did that really changed the whole process of how scientific information was disseminated and how power balances were different. But they were like very angry. And for people who are not familiar with them, the scene I will usually introduce students to is showing a video where these gay men, mostly gay, not only, but mostly gay men, there were others too, took the ashes of their loved ones to the White House lawn in 1993 and threw the ashes onto the White House lawn. And of course, now I think if you did something like that, they would send you to Guantanamo Bay and say you were, bioterrorist. But they really bravely did this and were furious. And those kinds of things got action. When direct action gets the goods. And so I think that ACT UP is really informative that we may not be that many in number. Like ACT UP was never more than 7,000 people nationally, but they got enormous results. And that's a good lesson to remember. Like in your community, you can do really amazing things together. But don't discount the power of the anger that you feel.
Appreciate that. I oftentimes think back to when I lost my dad. I describe it as I feel as if I had a Category 5 hurricane stuck in my body. The anger I felt against the government, against the failures of current leaders, of the systems of oppression that made it so, my neighborhood, he was one of the first to get sick once the virus spread from New York. It was, I remember also when he was in the hospital, having a moment where I thought, oh, well, this is what agony feels like. And I knew that if I did not do something to get it out of my body, that it would destroy me. So I think that finding ways to metabolize your anger, and where you can do it through activism, sharing your story, building community, bearing witness to the atrocities, not kind of turning off what's going on, but then also finding spots for nourishment are so essential. That's what this community is very much for me. Jared, final question from you, and then we're going to have to let our esteemed guest go.
Oh, wow. I mainly just wanted to say thanks. I do follow the work on Twitter as well, and the things that you mentioned at the beginning around kind of the twisted blessings that we get from this is resonant. And I wondered if I give an anecdote out of New Mexico. I find our Department of Health not able to chew gum and walk at the same time. But I can see examples from the indigenous women's community of being able to do that. The example would be we have vicious wildfires, and what the Tiwa Women United started to be able to figure out is the same things that protect their elders from wildfire smoke protect them from COVID. And they began that in the spring of 2020. And they have since made a practice of making sure that all those elders have it. So they take those people at the margins and put them at the center. And as a local example, I keep going and thinking, what would it be like, and what examples of this mutual aid, of this new collaboration birthed out of the devastation, sort of the love and rage combined, what other examples can we look for? We have our Marked by COVID, and I give that one example, and I'm curious if you have ones in your experience of working that are like, this is an amazing way that people support each other through very dark times. I know you've indicated them already, but that was the question. Thank you.
Well, thank you so much for sharing that. I've seen a lot of different things, and sort of at a micro level, I write about this in the book. I had two friends that we worked together at the Village Voice, and we've been in and out of touch. But then we were on our union bargaining committee, and as I always tell my students, the people you're in a union with, like those relationships last beyond your jobs and throughout your whole lives. But it had been almost 10 years since we had worked together, and then we all planned Ward's funeral together. And now we have Zooms, once a week to once a month. We check in with each other. And I think a lot of micro level things like that have happened for people that in a city like New York, where you just feel, oh, you're so busy and you're concerned about your career, it forced us to slow down and connect with one another and remember, like, yes, this is like why you're alive. And so kind of at a micro level that happened. And I think that there's enormous, at a much bigger level, there's an enormous possibility, and these connections are happening between environmental justice and pandemic justice. And, not to scare anyone, I'm sure many of you know, that climate change is, among its many problems, is also displacing animals and putting more living things on a smaller part of the globe, and bats in particular. And we're going to see more viral transmission when this happens. And I think whenever these connections get made, when you understand that reducing viral transmission means reducing the prison population. Reducing the prison population means supporting educational workers. Supporting educational workers means that that their labor issues, all of these things are connected together. But I think particularly there are really exciting things happening between environmental justice, reducing things like wildfires, and seeing that the viruses, like they show how connected we are and how precious we are. And so I think that environmental justice can learn a lot, both tactically from what's happened now, but also how we've survived this pandemic gives us the blueprint for dealing with the big issue of climate change. So those are some of the ways I've seen it. But I'm seeing people make these connections on all different kinds of scales. And for me, the most meaningful was reconnecting with these friends to plan our coworker's funeral, and then making a pact that we won't fall out of each other's lives again, as we had for a couple of years.
It's beautiful. Thank you so much for being with us here today. This conversation has been so rich. It has been a balm for our souls. I know it's been one for mine. To the comment of like staying up and reading the book, since my dad died, I've had a really hard time reading, to be honest with you, but I was blowing through this. So I see the love. I see this work is also driven by love as well. And for folks who are new to Marked by COVID and our community meetings, I appreciate you being here. I hope everyone, checks out the book, purchases the book if you can from an independent bookstore.
You can also request it. You can also request your public library. Get it. Almost every library has a website where you can just go and request an acquisition. So you can also find it for free that way, and help other people in your community read it.
Exactly. And for folks who are new to us, hope you come back. We are later this month, we'll have Dr. Opal Lee with us, who is the grandmother of Juneteenth, talking about her activism there. If you are interested in staying further involved, I dropped in the chat some of the task forces that folks in our community are currently signed up on to advance our legislation for a COVID Memorial Day, and our plans around COVID Memorial Day in 2023 in our state level. And also I have to make a plug, if you are capable of helping support this work, we are, not funded by any institutions. It's just the generosity of people pitching in what they can. We are sadly only at having raised $311 this month, out of a need of at least $3,000 a month to keep the lights on. So if you yourself have any capacity, please help us out. Two, if you are an individual who is connected to folks that work at foundations, or who can write grants or can kind of help us build our capacity, please make those connections with us, because we are doing a big fundraising push right now. And if you are interested in volunteering, please reach out. There's tons of roles to help build this. And as Dr. Thrasher said, it doesn't take 1 million people. It takes as many people engaged doing what they can do. And every single one of us has a superpower. For many of us, that's sharing our stories. But maybe for others, it's filling out a spreadsheet or, something, some other kind of action. We're definitely very much appreciate any support that you can give. And I just put the link in the chat for if you're capable of supporting the work. Dr. Thrasher, thank you again. I'll see you on Twitter. Let's do this again, okay?
Yes, thank you from the bottom of my heart. This was a balm to my soul, especially from all of you who shared your stories. And thank you, Kristen, so much for what you do. I was so touched to be here tonight. Thank you.
All right, everyone, we'll see you next week. Be well. You are all worthy individuals. Just remember that we're in this together and we're not going to leave each other behind. Thanks.